Well, greetings to everybody. I hope I'm finding you well. My name is Dr. David Hanekom. I'm the Chief Medical Officer of Solve.Care, and it's my privilege today to speak with you about Solve.Care, our plans for the future, and the launch of our Global Telehealth Exchange. Before I start, please allow me to express my commiserations and empathy for all those of you that are affected by the pandemic, especially those of you that may have personally experienced or have family members that have been affected by the COVID-19 pandemic and who may be mourning the loss of a loved one or a friend or a relative. Our thoughts are with you, and as Solve.Care continues to make healthcare work better for everybody, we, together with you, are putting all our resources in place to make sure that we can rebuild our communities, our economies, our circle of friends and family to continue our lives as a unified human race. If I can have the first slide, please. Solve.Care is committed to making the world a better place and making healthcare working better for all. So what we're going to discuss today are firstly who we are, where the world is today in terms of the significant disruptions and reassessment that we're all making as we're thinking about how we will live our lives in a COVID-19 pandemic era, and what does the future hold for us? What does that mean for the physician and patient, and the need for us to change how we behave and put mechanisms and systems in place that allow us to grow our communities, to continue to function effectively from a health delivery system perspective, and how do we improve the health delivery system that we have all over the world. What that means for Solve specifically, how we can create a win-win for everybody, and then this will be followed by a Q&A session where Mr. Pradeep Goel, the founder and CEO of Solve.Care, will join me, where we will answer questions that are submitted to us via our online chat room. So thank you for spending time with me today, and I hope that we can learn from each other and that you can see the potential benefits of redefining healthcare delivery, financing, and care coordination across the world. Next slide, please. Our mission and vision at Solve.Care is we want to make healthcare work better for ourselves, our parents, children, society, business, and the global economy in general. We are in the process and will continue with redefining care coordination, benefit administration, and payments for all stakeholders by really empowering patients and making healthcare work better for all. That is certainly a tall order, and this is a journey that Pradeep and I and our associates at our company and many of you have been on for decades. And the current pandemic environment is forcing us to reassess the current efficiency, functionality, and relationships that exist across the healthcare delivery ecosystem that is going to help us go towards the future with confidence and in a planned manner be successful. So if I can have the next slide, please. Our current situation is a global situation, and it demonstrates to us that we as a community of humans are living in a world that is flat, that the actions of one individual or one community or one society can have a significant impact for the good or not so good across our globe. And as humanity, the most current crisis, the pandemic, is and has reshaped businesses, our lives, and healthcare for everyone. So this is an appropriate time to talk about what have we observed, what do we think the future may look like, and how do we go forward and be confident that we can continue with our activities as humans and continue interacting with each other in a global manner to the benefit of all mankind. So let's look a little bit, if you'll forgive me, if I can just do a little bit of a retrospective scope in terms of what I've observed and what I've noticed in the United States, where I am currently residing. I'm sure that there are nuances in the rest of the world, but that the basic challenges that we have all faced over the last few months are very similar. So if I can have the next slide first. Our health delivery system, specifically in the United States, has really been predicated on the patient and their family accessing health care, both for wellness and chronic disease and acute needs, on the terms of the providers. In other words, we go to facilities, to offices, and to places where these valuable resources are in place, where we have to follow certain procedures and policies and procedures and processes that very often don't make sense to us, but it is a concentrated manner of getting health care. What the pandemic has created is an environment where, for the first time in a very long time, accessing the formal structural healthcare delivery system in their offices and in our hospitals, our emergency rooms, our long-term care facilities, etc., has for the first time become problematic, in that these are sites where potential spread of the coronavirus is focused. And we have a situation where both those that provide healthcare and those that seek healthcare through the normal mechanism of interaction have potentially put themselves at risk for not only contracting the virus, but suffering the severe consequences of such an infection, such as, for example, requiring acute intensive care and potentially losing one's life. So you have physicians and patients in the same situation where the normal interaction could be hazardous to both individuals or systems. And as a result, we've seen a significant decrease in the number of patients that are accessing their physician through face-to-face visits in person in the normal environment, somewhere between 40 and 60%. And we can all understand why that is, as we scrambled to become prepared and react and adjust to the needs to socially distance and make sure that we seek appropriate healthcare in the appropriate time and the appropriate manner. That has placed significant stress on all of us. The consequences are that the revenue to the healthcare providers, as well as the risk to their lives of potentially engaging individuals that may have the virus or are acutely ill, has resulted in significant economic hardship, as well as the foregoing of care. And so that is problematic, as we have a healthcare delivery system across the world that needs to be sustained. We have infrastructure, people, processes, and procedures that were not really designed to meet the needs of an environment with a highly infectious disease such as we have currently. If I can have the next slide, please. And I'm sure that this is occurring across the world. We have seen a significant and severe financial hardship, in addition to the emotional and personal and disease burden hardship that has imposed on all the stakeholders within the marketplace across the world. And many, many healthcare providers all over the world have the need to continue meeting the needs of patients while maintaining their businesses and paying their staff, their associates, to be able to deliver wellness and healthcare, whether that is due to coronavirus or due to any other condition that patients have. If we go to the next slide, please. And so not only has there been a decreased access to what I would consider essential primary care services and specialist services, but because of the potential risk to individuals and their caregivers and providers as they have face-to-face interactions as part of healthcare delivery, patients have become fearful of contracting the virus and have appropriately so been socially distancing themselves. Unfortunately, a consequence of that has been that there has been a significant neglect, albeit out of necessity on a short-term basis, of managing their chronic conditions. And because of the fear that individuals have for accessing our healthcare institutions, many patients are suffering strokes, heart attacks, and various other clinical decompensation that is part of being a human and aging, that we have not seen care for, and where there's an essential need for that care. So people are foregoing, because of fear, necessary in-person interactions with the healthcare delivery system that is resulting in what we believe will be an increased number of strokes, heart attacks, and other medical conditions which are not necessarily receiving the urgent and timely care that's necessary. And this is very understandable, of course. And we can assume this not only from anecdotal stories that I hear from my colleagues in the industry that are practicing medicine, of patients presenting late to the hospital with completed strokes and heart attacks, potentially other infectious conditions, that continues to require the care and the personal engagement with their care teams across the world. And so that critical help has predominantly shifted during the pandemic to virtual medicine or distance medicine or telemedicine. If I can have the next slide, please. So what the current global situation is uncovering is the weaknesses or the inefficiencies that exist within our health delivery systems globally. At the same time, must one remember that the situation that we find ourselves in, with a highly infectious disease where the transmitting individual and the host are humans, and where we are social animals that need to be engaging with each other to live our normal social lives, that is a very unusual circumstances that has required us and is requiring us to think differently from how do we manage this new environment while meeting the needs of the various stakeholders, most importantly, the individual patient. And so there is a need for us to rethink, how do we get access to healthcare? How do we meet the needs of patients in a pandemic environment and post-pandemic environment, whatever that's going to be? And how do we engage the various stakeholders in a manner that allows us to meet those needs? So when we go to the next slide, it's just an example of the need to use technology and different manners of accessing both individual patients, providers, consultants, and specialists to be able to deliver the best clinical care we can in an appropriate, timely manner to meet the needs of every individual, both the acute needs from a COVID perspective, as well as their chronic needs and wellness needs. And therefore, we've been working very hard with our stakeholders and our partners to bring to you a global telehealth exchange. And if you go to the next slide, please. There is clearly a need to find a channel and mechanisms to allow individual providers and health delivery systems to meet the needs of the community in terms of wellness, healthcare delivery, healthcare support, and that includes the administrative as well as the payment mechanisms that are currently the infrastructure by which healthcare was delivered in the past. And there's a need for us to reassess all of that to get to a place where we can deliver safe, effective care, where we can use the technologies and our capabilities and drive the best clinical outcomes and the greatest community health we can. And so, next slide, please. We believe that the patient remains in the middle of all that we do in terms of healthcare delivery, whether it be at the individual patient or at a community basis. There is a need, we believe, for a global telehealth exchange where there is a platform that allows patients, doctors, and other healthcare providers to connect via telehealth capabilities that removes the administrative, regulatory, financial barriers that currently exist with existing systems. The majority of the current telehealth services provided was really designed to provide care to individuals with minor clinical conditions, such as sore throats, sinusitis, allergies, self-limiting diseases, as a convenient way to access healthcare at the patient's timeline and to reduce access and the resources required with accessing the formal delivery system through emergency rooms, walk-in clinics, etc. And for that purpose, the systems have been very well designed and have met the needs of the majority of patients. Clearly, what is required now is a permanent solution where individuals cannot only access these healthcare service providers of their choice at a time of their choice in a manner of their choice, but that this capability now be extended not only for minor clinical conditions, but also to manage behavioral health issues, to manage complex chronic disease, and to really further the need for complex care coordination across a very complex health delivery system globally. Patients need immediate access in an environment where they do not expose themselves to potential infection with COVID-19 or any other infectious disease that may come in the future. They need to have access to healthcare providers of their choice, and they should not be limited not only to their local geographic area, but as we've seen, there is a global community of physicians and healthcare providers with incredible skill and capability that is absolutely necessary to manage a global threat such as pandemic virus. There is a need for simplification of the payment system to make sure that this access can occur, and we think that the digital payments and tokens in the form of Solve would be a mechanism to connect patients all over the world with service providers and healthcare providers of their choice globally. We can do so securely through a care wallet that belongs to the patient, where their necessary privacy and their preferences for accessing care can be protected, where information can be shared at the request of the patient or physician in a manner which is efficient to reduce some of the interoperability issues, that patients are able to access care networks globally to meet their needs as opposed to being limited to their geographic area, which, as we know, with the geographic inequalities that exist in terms of economic status, access to healthcare services, providers, to advice, to counseling, etc., is limited in some areas of the world. And there is an opportunity through a global telehealth exchange and blockchain specifically to support that kind of journey. And so there is also a need, in my opinion, for telehealth service providers, those technology companies and vendors that have invested their resources, their financial capabilities, and have been serving large communities, albeit locally or regionally, to be able to find potential service providers in the form of physicians and dentists and other types of service providers who can then use their technologies to the best interest of patient and support the need to make sure that we can deliver high quality care in a safe manner. So if we go to the next slide, please. We have endeavored to develop and will be launching a global telehealth exchange based on the principles and a blockchain enabling platform where individual clinicians will register and receive a global ID that is unique to them and identifies them as a service provider on our platform. Think of this as each individual provider will get a global telemedicine ID that will be made available under certain conditions with appropriate safeguards around credentialing, capabilities, area of practice, geographic area of practice, availability, etc., and will be searchable and will be connected with not only telemedicine providers, but also patients who can then choose their care circle and their care team based on this availability and their need to access these services through distance medicine. This global exchange will allow patients, no matter where you live, to identify specific individual providers and or systems or networks, and will allow you at your request and under conditions of transparency in terms of payment, access, services delivered, to access these services. The security will be guaranteed by the blockchain platform that underlines this technology, and will create a way for us to extend the excellent services that are currently being provided by providers as well as their telemedicine vendors from a local, regional to a potential global footprint. And I think this is necessary so that we can guarantee access to individual patients during any time of need in a safe, secure manner that is timely, affordable, and that we can guarantee access in a safe manner while we manage all the needs of a patient, from minor clinical illness or condition to complex care coordination, to acute care, to monitoring, and to access behavioral health services for counseling and the various other modalities that are available. And so what you're seeing on your screen are just examples of what this platform would look like. If we go to the next slide, please. A very similar, the whole administrative process of setting up an appointment, of checking eligibility, of understanding what the payment is going to be, understanding what the service will cost, and guaranteeing that administrative processes are managed within the platform in a satisfactory manner, where those that seek services are able to get access in a timely manner with a service provider of their choice in a safe, effective manner to meet their clinical needs, as well as the need of the clinician and the other service providers to know that they will be paid and that they will be reimbursed for their essential services in an effective, efficient manner is absolutely critical in terms of support through the solution. It is necessary for us to make sure that those individual service providers, be they clinicians or other allied health workers, wherever they are in the world, can feel assured that their patients can access them, that they can extend their potential sphere of influence, and that they can serve more individuals in an economically viable manner, that those things be guaranteed by a solution such as this. The revenue crunch that is occurring all over the world as a result of pandemic cannot have an outcome where physicians close their offices and their services are no longer available to the community and to the individual patients. That would be catastrophic, and I do not see significant mechanisms in place with the current financial system and the reimbursement system such as we see in the United States and other countries through insurance carriers, of guaranteeing the timely payment and the guaranteed payment for the vast majority of physicians. There are great efforts being done by the major payers, but the previous system was really not designed to meet the future needs, and so we want to be part of that solution. Next slide just shows you an example of the medical records, the ability to share information, to make sure that the administrative processes are efficient and effective, and to really reduce some of the administrative burden that rests on physicians and their staff's shoulders at this time. It is not appropriate, it has never been appropriate for a clinician in the United States to spend 2/3 to 75% of their interaction to provide clinical services to individual patients on administrative tasks, such as the case today. This is not an effective or efficient manner of using those highly qualified and necessary resources across the ecosystem globally, and making sure that we reduce the administrative burden, and that we do that for both physician, care delivery, payer, as well as the end consumer, the patient and their families, is a goal that we all strive towards, and I think this is a first big step in that area. Next slide, please. And so appointments. It is exceptionally difficult to find appointments with physicians at times, simply because of demand and resource ability, as well as the very complex and physician-centric systems that exist within the world, and a efficient mechanism for an average patient across the world to be able to make an appointment through very simple capabilities, where the physician can publish their availability, can choose what type of patients they would like to provide services to, where they can publish the price for those services, where we can guarantee a mechanism to make sure that the individual gets the physician at a time, at a price, and in a channel that meets the need of all stakeholders, is a critical component of this. And so it will be a major focus of us as we connect all these stakeholders together to use the the exchange. Next slide, please. I have spoken about the importance of a global personal blockchain zip code for every service provider or physician. Physicians are scarce resources all over the world, in some countries more than others. And there are literally hundreds of millions of individuals that do not live near a physician and have difficulty getting access at the best of times to physicians. And so taking that incredibly valuable resource and making it available in a very transparent, very safe, secure manner to the global community allows us to extend those physicians' reach and the good impact that they may have on society's health and wellness on a long-term basis. And so with the necessary checks and balances in place to ensure that physicians are appropriately credentialed, that they meet the regulations for telemedicine and for types of services and geographic area of service provision, and using the technology available to us, we can certainly make a great impact on that equation. It is time that the citizens all over the world should be enabled to access the best distance clinical care possible, no matter where they live, what their financial situation is. I fully understand the need to restrict physicians' licenses for various legal and patient safety and various other reasons, and that's certainly appropriate. But where the restriction of physician practices and their ability to reach out to more people and do more good to a larger number and meet the needs of the global community, we want to use our solution to make sure that those barriers are removed, and so we can do a greater good for a greater number of people. Next slide, please. Every patient should have access to their personal wallet that wallet being a care wallet that can be downloaded from the internet. It is yours for life. It is secure. It's encrypted. The patient should be in control of making their appointments. They should be able to access physicians' networks globally of their need, and should be able to choose where they receive the care through distance medicine, where it is safe, efficient, and appropriate for them. This does not negate the need to also have local services and access acute care facilities and all the other infrastructure that exists in the world. That will always be a necessity, but there is a need to make sure that when we use those resources, that it's appropriate, necessary, and affordable and sustainable long term. So this is a way for us to potentially to make sure that the healthcare dollar that's available all over the world, be it funded through private insurance, individual patients, and or the community and or society, stretches to a level where we can provide the best services on a long-term basis in a sustainable financial manner. Next slide, please. The token. There is clearly a need for a digital token and or voucher that simplifies payments across not only geographic areas, but also across global communities. I think a vision of being able to find the physician or service provider of your choice who can meet your needs as an individual patient can be supported by this. It is a manner by which individual patients and providers, payers, and other stakeholders can exchange value in a guaranteed manner and speed up the entire payment system in a manner that is secure, global, and will support the needs of an open global market where competition will result in better care, in my opinion, lower total medical costs, and will drive not only consumer, but stakeholder, physician, and patient satisfaction. And so there are capabilities within the network where that is a focus, and it will allow an individual, for example, in a remote community somewhere in Africa, Asia, the United States, in Europe, to access the same quality and quantity of distance medicine services as somebody that's privileged to live in a large city with a huge infrastructure at a reasonable guaranteed cost that is exchangeable, and receive the best care that the worldwide community of physicians and service providers can provide, as much as it can be through a distance medicine solution. Next slide, please. It's clearly a game changer. It needs to break down the geographic barriers between doctors and patients. We've discussed this. There is a critical need for care continuity and care coordination across a very complex, fragmented, and administratively inefficient system internationally. And so that's one of the main aims. And so the need to be able to, for the patient, not only to join care circles or care networks of their choice based on their unique clinical needs, and to do so through a enabling technology where they have choice and can access the best minds and best services internationally, is the way in which we look after our global community while meeting the needs of our local community as well. And so many of those things will be met by this solution. Next slide, please. The token is well utilized internationally and has already been recognized by the market as a token of value that can be applied to the exchange of healthcare services across the world. And we continue to support that community to make sure that the revenue flow that's necessary for the health service providers internationally continues to maintain a healthy healthcare economy and provide those services and providers access to a market of patients where they can meet their needs and do good. And so we'll continue with that journey. Next slide, please. Our focus is on making sure that all the stakeholders can join this Global Telehealth Exchange. I extend an invitation to the telemedicine service providers all over the world. To watch the news, we'll be asking you to contact us and create a mechanism for you to become a unique service provider on our network, where you can continue managing your relationships with your providers and patients, but also extend your capability to a much larger global community, to physicians, dentists, other service providers, a unique blockchain ID where you can be found by any patient and any other service provider in the world, and can start forming relationships and become part of a wider global network of service providers in the best interest of every patient and every citizen across the world will be made available. There will be incentives to join the organization, and those of you that influence and are willing to refer, etc., should be rewarded for that. We have some timelines that we will share with you in more detail, but our initial focus is on allowing individual physicians, dentists, clinical psychologists, chiropractors, naturopaths, etc., to sign up and create and reserve your unique identity. We will then be focusing on the telemedicine and distance medicine vendors to become part of this marketplace where they can find you and you can find them. Or if you wish to use our capabilities, you're welcome to do so. And then we're going to invite you and the other stakeholders, as well as the global community, to start connecting their wallets to the network so that we can support the delivery of excellent clinical care through distance medicine on an international basis. And I'm convinced with this degree of opening up the marketplace for patients and physicians and service providers and vendors to find each other, that mutually beneficial relationships will occur, that a larger number of patients will receive a timely access to the providers of their choice, and providers will be able to serve the common good by providing their unique skills and capabilities to a large number of patients internationally and drive the health and wellness of our global community. This will certainly prepare us better for a post-COVID world where we have to take these considerations into place, and will prepare us better for any potential future crises that may occur. We truly are a global community. We have all the capabilities we need to support each other. We have learned, and we are learning, the importance of global citizenship whilst acting locally, regionally, and internationally. And this should certainly be extended across the global community to the use of an incredible technology to allow us to provide distance medical services, as well as other behavioral health and other wellness services that can benefit all of mankind. Next slide, please. There is a referral program in place. We want to make sure that we create a win-win and an immediate revenue opportunity for not only patients, but every single physician that signs up to the network. It is appropriate that you be rewarded for your actions and that you can support the financial needs of your organization and your practice so that you can remain a viable, extendable physician that can provide care to those that seek your help. And for patients, it is the same principle. You should be able to sign up, you should be rewarded, and you should be able to refer your friends and family to excellent clinicians, which is the standard of practice all over the world. And for that, there needs to be a mechanism for you not only to be rewarded through tokens, but that those tokens can then be exchanged for clinical services that meets your individual needs. And we think that that will be very successful. Next slide, please. Next steps. Pradeep has been talking to various segments of the market about our plans. I have the privilege today of sharing our vision with you. I'm sure that you will be talking to many people. We will be publishing the referral codes around about June 15th, which means as individuals, be they physicians, vendors, citizens, patients, and other stakeholders refer individuals to join the Global Telehealth Exchange, that there be a reward system. We are going to focus initially on the physician sign-up process so that each physician can reserve and obtain their unique blockchain ID as a Global Telehealth Exchange physician member. Patient sign-up will start occurring around about the middle of July. And our intent is for the Global Telehealth Exchange to go live August 1st to enable and facilitate those unique and absolutely necessary transactions and relationships that need to occur. We'll provide you with additional information so that you can see the processes and mechanisms by which this will occur, and we'll provide additional information. I'd like to go to a Q&A session right now, and I would like to extend a very warm welcome to Pradeep Goel, founder and CEO of Solve.Care. Pradeep, good day to you. I know that you are in the Ukraine, where you are not only leading our company, but providing direct oversight to one of our global development offices. And so we will be answering questions as they become available on the internet. And Pradeep, if you would please introduce yourself to those that may not know who you are, and just set a stage for us before we start the first questions, please.
Thank you, Dr. Hanekom, and thank you everyone in the community listening to us. Really appreciate Dr. Hanekom's introduction to Global Telehealth Exchange. We are very excited about this initiative. We feel it's an incredibly appropriate use of Solve.Care platform in the current and the future environment of healthcare. And I'm very much delighted to have Dr. Hanekom be part of our team in providing us clinical and strategic guidance, both as an experienced physician and as a population health management expert. So I'm looking forward to the questions and answers session. And we have several questions here. But I think, Dr. Hanekom, I'll turn it over to you to start with some of the questions directed at you, and then I'll pick up the rest.
Certainly, thank you. You'll see me looking to the side. It's just to read the online questions. I'm not ignoring the community. But the first one is, when will the Telehealth Exchange be available for general use? And will the Solve token be used on the platform? The answer is yes, August 1st. This year, we will make it available and expect to see significant transactions occurring across it and connecting individuals to do what they do best, which is take care of each other and provide excellent healthcare services. The Solve token will be the mechanism of financial reward as a voucher and a payment system across the entire stakeholder segment on a long-term basis. Good.
The next question for you, I believe. I believe so. The question is, what kind of APIs would be available for third parties to access the Global Telehealth Exchange? So if you think about it, our fundamental premise here is that we are linking doctors and patients in a well-designed administrative, financial, and care coordination framework. As a Global Telehealth Exchange, we provide all the infrastructure for doctors and patients to interact with each other, to make real-time payments using Solve tokens, and to also connect to all other care networks, be it diabetes care network, be it cancer care network, mental health network, and dozens of other networks that Dr. Hanekom and others clients are designing and expect to launch. So the whole notion is that through one care wallet, I as a consumer can connect to the GTHE and every other disease network that I need to join, and that's different than what you need to join. Now, in that framework, we want to allow third parties to connect their services and deliver those services as another form of a network. So any other telehealth provider, be it telemonitoring, teleconsultation, telediagnosis, these solutions can either be injected into the Global Telehealth Exchange as a care card, or they can be stood up as a standalone care network linked to the GTHE. So between those two options, whether you are injecting your services into GTHE to access all our patients and all our doctors and make it seamlessly available in our framework from the Care Wallet and using Solve token as a payment mechanism, you can do that very quickly. So if you have a great idea, a great app, a great device, or a great service, you can offer that as a singular care card. Or if you have a very comprehensive, complex solution that requires you to stand up your own care network, you can link that care network to GTHE care network, because all care networks can interoperate. Between those two scenarios, we can address startups, we can address big established telehealth and telemedicine providers, and everything in between. And to do that, we already have APIs for care cards, and we have APIs for wallet to connect to multiple networks. This is what our platform does. But this model of telehealth, of multiple care networks coexisting and elected and joined by one care wallet, creates an interoperability framework that has no parallel in the world. So I'm very excited about what we can do to open the door to better care for patients and open the door for the doctor to practice medicine the way they want, when they want, and how they want it. And this is done through the platform, the Solve.Care platform, and the platform, the capability of one single wallet to join as many networks as you need to. Dr. Hanekom, next question is, I believe, also for me. Is there any company or organization that participated in the construction of the system? As you can tell, this is a very large initiative. It has many parts to this: the platform, the wallet, the provider wallet, the APIs, the standalone disease networks, and of course, future networks that our partners want to stand up. And it comprises of multiple teams working for Solve.Care. Some are clinical in nature, some are administrative in nature, some of them are technical in nature, but of course, everything is managed and built by Solve.Care on its platform. So it is not a one-team job, and it will continue to be managed by my team and ultimately by Dr. Hanekom and I as the executives. But yes, it is a very large organizational endeavor, and it has many parts and many pieces to it. All of them are working in parallel to deliver the solution to the world. The next question is for you, Dr. Hanekom.
Yeah, how many doctors do you currently have signed up? We're in the process and have received significant interest from provider types all over the world, ranging from physicians in the US, dental networks in the US and other countries, Europe, Vietnam, Singapore, etc. And so we're in the process of communicating with those various interested parties. We, as I said, will start recruiting and sign up these type of providers to meet their needs and get them a global exchange ID. I'm in the process of setting up advisory committees of individual provider type stakeholders. I believe it's critical that their needs in terms of what the platform needs to facilitate and be able to support in terms of clinical care, documentation, payment, etc., are taken into consideration as we do this. There are geographic nuances in terms of credentialing, extension of telemedicine license, etc., that we need to take into consideration. But I've been very, very encouraged by the outreach that we've received from not only individual physicians, but also networks all over the world, ranging from dermatologists, behavioral health networks, dental service providers, chronic complex, large organizations, individual small practices, etc. And so, as Pradeep has said, physicians have a need to do things differently. They are very engaged, and I anticipate that they will remain engaged. As a critical stakeholder of this solution, their needs from a clinical, social, financial, regulatory perspective must be met, and we will match that to the needs of the individual patient and their family in terms of their need of those service providers. And so I'm really looking forward to having a very robust multi-stakeholder provider network when we launch in August. There's also a question about the right prescriptions. The answer is yes. Many of our telemedicine vendors that will join the Global Telehealth Exchange have full capabilities already. And with those capabilities to do eligibility checks, prescription prescribing, all those capabilities exist, we will utilize that capability and not reinvent the wheel. But where there are providers that are in an area or want to choose to use the Solve.Care, will meet all those needs as well. So really, we want to create a marketplace for individual physicians and those that are already in this space, vendors that have expertise in this space, can produce those services on our network and be connected with more potential patients, customers, and service providers.
Okay, I will take the next question. Will there be any advertising campaigns to get patients and doctors signed up? It is actually a complex question with a complex answer, but in a nutshell, certainly there is a direct-to-provider outreach campaign globally, where we want to make sure that every physician who is practicing medicine as an independent or a small clinic or even part of a larger network knows of their options in using the Global Telehealth ID to be seen worldwide, to be found worldwide, to be verified worldwide, to be contacted and communicated and transacted with worldwide. Listen, there are many provider directories around there. They're printed on websites and they're printed in PDF documents. They are useless because in the end, all that does is tell somebody your contact information. There is no transactional ability in a provider directory. We decided to fix that issue and give the provider an interaction and capability presence. Think of it as a private World Wide Web where you can actually do something with the doctor other than find their name on a website. And that interactability has to be secure, it has to be safe, and it has to be controlled by the physician. And that is the fundamental premise of the GTHE, is that it is a place where a physician can publish their credentials, their availability, their rates, their appointments, their eligibility criteria, the type of patient and the demographic of the patient they are looking to serve and when, and allow the patient to interact with them for the full life cycle of finding a physician, verifying a physician, making an appointment with the physician, paying the physician, seeing the physician, getting the prescription, getting care continuity, and making repeat appointments or getting referrals to another physician. This is healthcare at its core. And to make that interactive, the GTHE is the platform, and we will make it available to every physician on the planet to use. And it does not mean they have to stop practicing medicine the way they practice medicine today. It supplements and augments the way they want to practice medicine, moves them to a level of efficiency and efficacy that every physician wants because they didn't sign up to become a data entry clerk when they went to medical school. And this is what we are fixing. And this is what we want to do on a global level. So having said that, the go-to-market strategy is a referral program, which we will announce in a few days, which will allow ambassadors of Solve.Care to go out there and find physicians and educate them on what the GTHE does and why they should sign up. There is also a direct-to-physician outreach that we are doing from Solve.Care physician relationship management team. And we're also going to use third parties who are looking to build physician networks. And we're already hearing from various physician networks, be it dentistry or telemedicine or psychiatry or dermatology, who are saying, this is great, we want to have our members join your GTHE. But our mission is big. It's not going to happen in a day or a week or a month or even a year. But each day we want to add more physicians to the network to allow them to practice medicine the way they want to practice medicine. And we want to facilitate that through GTHE so that patients can actually find the physician they need to work with. So the campaign is not one day campaign or a week campaign or a month campaign. Think of it as a perpetual campaign that we have to run. And it is going to be part of our GTHE launch, growth, and maintenance strategy. Dr. Hanekom, would you like to take the next question?
If a patient is in a different country than the doctor, will the doctor need a license to practice in the patient's country? Absolutely. As we all know, the facts of life in terms of taxes and death, there are also regulations and law. And so we want to make sure that we're absolutely compliant. As a facilitator and the platform underlying the Global Telehealth Exchange, it's our expectation that when we do the credentialing part and we bring on partners and stakeholders, that they will have local knowledge And where it's necessary for us to do international or global credentialing, we'll be able to do that. And so it is important that we protect patients. These mechanisms exist to make sure that appropriately trained and credentialed individuals are providing services consistent with oversight and regulation. Where there are regulations in place that do not make sense, and in fact harm patients and or providers from delivering our mission, we will be a strong advocate together with our partners to make sure that we extend the excellent services that physicians and other healthcare providers can provide to a larger number of global citizens. And so the answer is yes. And where we need to advocate for change to improve and make sure we can deliver better care at a lower cost and drive more satisfied service providers and patients, we would be first to advocate for that capability.
Okay.
Pradeep, looks like the next one is yours.
Okay. The next question is related to, will Solve tokens be used to pay doctors? So Solve token is the currency of the network, not just of Global Telehealth Exchange, but every care network that Solve.Care launches. Solve is the currency, whether that's diabetes, whether that's cancer or mental health, or Global Telehealth Exchange, or it is any other pharmacy networks we plan to launch. There is, as I mentioned, numerous networks in the works. Some have been launched, many more are to be launched. Solve is the common currency for all of them. It is obviously the easiest to understand when you think about making an appointment and paying a doctor with the Solve token. But it's actually quite a bit more powerful than that, because the Solve token can come from the insurance company, it can come from the employer, it can come from you, from your own purchase in the Care wallet, because you are the patient, or it could come from your care circle, offering you support to go see the doctor, as I would support my mother if she wanted to go see a specialty care provider and that was quite expensive. So the Solve token origination point can be multiple: insurer, hospital, insurer, employer, family member, yourself, government agency. But the payment is always in Solve token to the service delivery organization. Similarly, if there are automated services in the GTHE that we inject, such as telemonitoring or a device purchase, those are also paid for in Solve tokens. Solve is the only currency we will accept today, and it allows us to normalize healthcare around the world. We are not interested in dealing with all the cross-border payment issues and currency conversion issues. Solve is all the services and all the access to device and care through GTHE and every other care network is ultimately paid for in Solve. The next question is, what do I need to do to schedule an appointment? So that's pretty straightforward. A new version of Care Wallet will be released in conjunction with GTHE, and that Care Wallet will allow you the access to all the GTHE care journeys, including find a doctor, verify a doctor, communicate with a doctor, share your records with a doctor, make an appointment, make a payment, receive follow-up continuity of care cards, get a referral, post-referral, close the loop with the original physician who referred you, and so on. The whole care coordination fabric that Solve.Care platform will be represented as various care journeys or care cards in the Care wallet that is being released along with the GTHE.
Next question is, are there any partnerships with any existing telemedicine providers? We're exploring that and we're in the process of negotiating those contracts. We want to make sure that as a telemedicine provider and or vendor comes onto the network, that they meet our needs in terms of patient protection, physician protection, transparency, appropriateness, and that they accept the token and various other things. And we'll be making announcements about our progress in the marketplace as that continues down the market. But you can certainly expect a robust telemedicine provider and telemedicine vendor network when we launch in August.
The next question is, are companies going to buy Solve token from the regular exchanges? So this is not about companies. GTHE is about patients and doctors. And in the new version of Care Wallet, the patient will be able to buy Solve tokens directly within the Care Wallet using their credit card or their bank account. And this whole process of buying Solve tokens is being converted into a single touch Amazon type buying model. And that is in itself a huge innovation that Solve.Care is releasing in the market. We will talk more about it in a future webinar. But the notion here is that the patient, patient's family member, patient's employer, or patient's insurer can send payments directly to the physician in light of an appointment, either past or upcoming. And in terms of how those tokens are bought, they're always bought on the exchanges. Tokens are only available in one place, on the exchanges. And which is why we are expanding our number of exchanges around the world, and we are linking Solve to more and more fiat currencies so that people can buy Solve in their native currency without having to learn the crypto jargon. Dr. Hanekom, the next question is, what are the benefits to the doctors so that they will join this platform?
Oh, excellent, thank you. We have a lot of questions, but let's answer this one right now. The benefit is firstly that you're able to meet the needs of your patients in terms of getting access to you and the services you provide in a timely manner through a telemedicine medium where you can meet their needs, be it a minor illness, complex chronic care, care coordination, counseling, referrals, etc., etc. So I think that's a critical component of staying in touch with your patients in a world where there is fear to go to places where you could potentially get an infection or be infected when you travel. And so that's a critical component. It's also critical that that interaction occurs within a trusted, established relationship with you, the physician, that have built your reputation through the excellent care that you've been providing to that patient and their family for a long time. I also want to make sure that for the physician, that when you do this, that you can be assured that you will be paid timely manner before the service occurs, and that you have guaranteed payment through a token mechanism. That token can also be used by you to get care if you need that as a physician. You could give that to your staff, to your patients, to encourage them to get wellness services, whatever you need to do to grow your business as a clinical practice. And then I want to make sure that you as a physician are not limited to a single telemedicine platform as you manage your practice panel. So as you know, if you're a physician, for example, in the United States, doing telemedicine, you can have your own telemedicine solution. There is one that every single payer provides, every single hospital system in your area, and all your competitors all have telemedicine services, and it becomes chaotic. How do you coordinate and make sure that your presence on a global market is there, plus that you don't have to deal with all the administrative and technical complexities with multiple vendors? And so think of the Global Telehealth Exchange as the place where I am visible. I set when I work, what type of patients I'll see, how many tokens I need to be paid, what type of challenges I'll take on, and then I invite and accept invitations from patients and various other stakeholders to serve my needs as a clinician and as a practice. This puts the physician in the middle of all this with our Global Telehealth Exchange meeting your administrative practice, clinical care, and various other needs. This is a radical shift from where it is today. I can tell you from my own experience in the United States over the last few months during the pandemic criteria, that every provider that I have had access to as a patient, where I have complex care needs, as well as wellness and various preventative needs, has been complex. They've all had telemedicine solutions. As I've said before in my presentation, those solutions did not meet their needs for chronic care and during acute crisis as of the pandemic. And the vast majority of my personal clinicians have had to resort to a standard Zoom and or FaceTime app on their cell phone whilst managing the information needs in their EMR, and did not use their telemedicine provider because it simply didn't meet their needs. That cannot continue to happen. And so the need for this GTHE to really focus on the needs of the individual clinician and the individual patient, taking into consideration the resources and environment around that, is what the world needs right now. And so I extend an invitation to all the vendors that are working on this. I know they're all spending an incredible amount of time and resources in transforming their platforms to be able to do care coordination and complex care management, to bring behavioral health, more sophisticated, etc. And they're all trying to figure out how do we get payments and efficiencies in place. Come and work with us. I and Pradeep and our company are there to enable you to be more successful. We have no interest in being a competitor to you. There's a need for an organization like us to bring all the stakeholders together and say, listen, what you've built and what you've developed is valuable. Let's now accelerate, extend, and modify that capability to meet the needs of a new world. And that new world, patients are clearly signaling to us as a telemedicine and as a technology company, as well as all my colleagues all over the world that practice medicine, that the current status quo did not meet our needs, will not meet our needs, and you need to change. And those that change will survive and do well. And those that do not change or choose not to change may do well, but that's not guaranteed anymore. So this is really a global effort with us as an organization, with our mission to try and make the world a better place by making healthcare more accessible, simpler, more effective, etc. To say, we're ready to do that, please come and walk with us. And then the last principle is it must be a win-win for everybody. We cannot afford to have physicians go out of business. We cannot afford to have our primary care crippled, excuse me, by fear. We must support our institutions, our beautiful hospitals, research institutions, our infrastructure we have in place, and we need a smarter way to do this. I believe this is the smarter way of doing it. Do we have all the answers? The answer is no, but there are hundreds of thousands of highly intelligent leaders out there, and I'm inviting you to come and join us and make us a better company to meet your needs. Next question is about who will be targeted. I've spoken about that. We've had outreach from GPs, family physicians, specialists, dermatologists, psychiatrists, behavioral health, clinical psychologists, counselors, etc. If you are meeting the need of an individual human being in the healthcare sphere, be it wellness, acute illness, chronic illness, complex care coordination, you're welcome. The investment that you've made and the skills and capabilities you bring to the marketplace and to the world community is essential and necessary, and we will support that. So I have no restrictions in terms of what type of service provider could potentially join the Global Telehealth Exchange. We are not going to enforce a specific care model on anybody, whether it's the psychosocial biological model, whether it's traditional models in other parts of the world, naturopaths, homeopaths. It makes no difference to us. If you provide benefit to the world, and we can do so in a safe, legally compliant manner, you're welcome on our network, because that's what patients demand, and that's our mission, to make sure that we serve the needs of every patient as much as possible. There's a question about consultation fees across different countries, and there are only membership subscription plans in the works. We think, I believe, I know Pradeep believes, that the service provider and the patient in a free market economy should determine what the value is and what they want to charge for their services. Where there is external control by the society, by the federal government, etc., those prices are set and people adhere to it through their legal mechanism, and we'll support that. But it'll be in tokens, and you determine what is valuable, what your value is, and the marketplace, be those patients, families, other physicians, other shareholders, will make a decision whether what you're offering is valuable and efficient and affordable. And I am convinced when we allow people to do this, that we will all do well, because it does function in some areas as a global open marketplace. In other areas, it is controlled, necessary so, to make sure it's affordable and accessible. And from our perspective, that model will be supported as well. We're open to whatever model it is, but it really is in the end between the service provider and the customer, and whoever finances that transaction will set the price. That price will be token, and that token, of course, is guaranteed based on the price that was paid for. That mechanism is complex, and we'll provide more information about that. But it does mean that an individual with a cell phone, a smartphone, that lives in a rural area in Africa, for example, where I'm from, will be able to purchase tokens and will get access to the best medical care that virtual medicine can provide on their terms, using our platform and getting access to services that they do not dream of getting access today because of geography, because of infrastructure, because of poverty, whatever it is. I am convinced there are physicians all over the world where, if they are given the opportunity, whether I'm a subspecialist or a general practitioner in one of the most expensive areas in Asia, if I can provide some of my services for an appropriate payment to somebody in another part of the country and do good, will say to me, Dr. Hanekom, that's a no-brainer. I will not give advice or provide services that I think can harm a patient. And so we're opening up this incredible resource we have in the world to do greater good to more people in more areas, is the promise that I think the Global Telehealth Exchange and our partners can provide. And I'm very excited about that. I understand that there will be lots of concerns about regulations and law, etc. We, as a company and as a platform, and our mission is there to transform and support what's capable and also look at the future. And so we'll make sure that we're compliant in terms of what we host and what we facilitate everywhere that our stakeholders do business. Let's see. Question, Pradeep, about addressing interoperability challenges. You spoke a bit about that, but can you just talk a little bit more about that?
Sure. Thank you, Dr. Hanekom. This is a very important question, but I think I can summarize the answer. Interoperability has been attempted for the last 3 decades in the context of linking systems. We have built a lot of interoperability systems. I have been guilty of building many of them in terms of SOA fabrics and health information exchanges and EDI gateways and so on and so forth. And those are essential and they serve a purpose. But our vision for interoperability is that the patient is the interoperable hub, that the care wallet in joining multiple care networks, and for the patient to have instant and immediate access to the services of highly specialized care networks, be it administrative or clinical or financial in nature, and the ability to connect and interact between these networks at a patient level creates the best interoperability of all. So to us, the care wallet is the interoperability mechanism. The connection to multiple care networks and the ability to interchange care cards and to move between networks with ease by just swiping your network card to enter a different network. These are the kind of innovations that actually bring interoperability to the person who needs it the most. You, I, our families, our parents. And it is not about connecting more systems together. It's about giving you access to all the systems you need to have access to manage your care for the ones you care about. So our vision for interoperability and what we have been working very hard on is to make healthcare as easy as playing with a deck of cards by allowing you to connect to various care networks, download the right care cards, and connect them by sharing the right card with the right entity in different networks. And that interoperability is actually human and humane. And it does not require that systems in Australia must talk to systems in Zimbabwe. I, as a patient, can talk to a doctor in Australia and a doctor in Zimbabwe if I wish to, and exchange care cards with them as easily as swiping them. This is the interoperability we are after, and that's what we are implementing.
Well, thank you, Pradeep. There are many other questions. I want to be respectful of everybody's time. We asked for an hour of your time. It's already been an hour and 15 minutes. As you can hear, Pradeep and I are very happy to answer any and all questions related to our solution. Our passion is around making sure that healthcare works better for everybody else. So I want to thank everybody for joining us. If you have additional questions, please send them to Solve.Care or to us directly. We'll provide more information on our websites that you'll be able to access, and I'm sure that if there's a need, we'll have additional webinars where we can talk about specific issues related to the economic model. How do we support the economic models of the various telemedicine vendors? How much control is there, oversight, the auditability, etc. All very, very critical components and questions that you may have. I just want to assure you that our invitation to please join us and make yourself more successful and help us change the way healthcare is delivered, financed, supported, and marketed across the world. That's a sincere invitation. We are committed to this, and we know that there are many people over the world that have the same commitment. And so please join us. We welcome you in making us a better company and making sure that in the end we meet the needs of those we serve, which is essentially, from our perspective, a global community that needs access to excellent, affordable, efficient healthcare, and that they should be allowed to choose who and under what circumstances they get that care as much as possible without disrupting their need to access their local services and their local facilities. And then lastly, to make sure that we do so in a sustainable manner for the best interest of all the stakeholders. So thank you very much.
Thank you, everyone. Thank you, Dr. Hanekom.
Thank you.